Good afternoon, everyone. It's Dr. McQuillan from Berkshire Menopause Clinic, and today I'm going to be talking about your body identical progesterone, which you will be taking as part of your HRT. You use progesterone when you have a womb, because if you gave estrogen alone, it thickens the womb lining and puts you at risk of womb cancer. You may also be using progesterone even if you don't have a womb, but you've had a hysterectomy, so removal of your womb due to, for example, endometriosis. So where there might be womb-like deposits still left in, then you may be advised to also still take progesterone. So how do we use this capsule? So this is a gelatin-filled capsule. Normally we take it orally, so through the mouth, and we advise that you take it at night. The reason being is that it is associated with GABA receptors, which are associated with helping us sleep, our mood, keeping us calm. And so for a lot of women, its side effect of helping with sleep actually is beneficial, because sleep disorder is very common around perimenopause and menopause. Now, the biggest question I get asked is, I'm told to take it 2 hours after eating. That really isn't realistic for me. I eat late at night and then I have to wait 2 hours before I can even think about going to bed. So let me explain that to you. You do not need to wait 2 hours after eating and having it on an empty stomach. However, what you do need to be aware of is that what can happen with the capsule is that it can increase the efficacy of your tablet if you're eating. So when you eat, it increases the absorption and you may feel the effect more. So some people may describe that when they have a full stomach, the drowsiness is uncontrollable, and that is the reason. However, you may find you are absolutely fine eating and taking your tablet. So there's no medical safety reason for that. So you can do that. So you take it every day if you are not having periods, or your periods have been over 12 months since having the last period. And if you're not having any periods, then you would take your progesterone every night. If you are still having periods, or it's been less than 12 months, we advise to take it cyclically. The reason being, if you took it every day, the chances are you will just erratically bleed. How do you take it cyclically? Well, the license and advice dose is take it for at least 12 days a month. What I would say to women though, just to make your life easier, take it 2 weeks on, 2 weeks off, and that's that. When do you take it if you're still having cycles? Now, it all depends if your cycles are regular. You can start your tablet at any point. What you should always expect is up to 3 to 6 months of changes to your bleeding pattern, potentially more spotting, potentially more erratic bleeding, and then it should settle between 3 and 6 months. But to try and help that along, if you have regular periods and you know when your periods are going to be, what I say is, from the first day of your period, wait 2 weeks, then start taking your tablets, because you're going to be doing it for 2 weeks. So that then becomes a month. So then what will happen is your withdrawal bleed will try and fall in line a month later. So first day of your period, wait 2 weeks, start taking your tablets 2 weeks, and then that next withdrawal bleed should try and fall in line with your period and try and regulate that more. Now, some people are very intolerant to progesterone. They get massive amounts of side effects, and some of those side effects are PMS-like, so your bloating, your breast tenderness, acne, mood changes. But for some people, it is really intolerable and they cannot take progesterone at all, or cannot take it orally. Now, for these ladies, we may offer to have a discussion about taking it off license, and that is where you would take it vaginally. If that is you, we need to have that discussion first, because it's an off-license tablet, or it's off-label. And so we would discuss that, but that is absolutely an option. And again, the question gets asked to me, how do I take it? Now, you can buy the applicators, but they are quite expensive. You may correct me. Feel free to write in the comments if the prices have changed, and actually you can get them online in bulk a lot cheaper. But the easiest way, what I say to women, is squat down and then just use your fingers, insert it into your vulva as far as you can push it into the vagina. And that's that. because you're taking it at night, and I appreciate some people do shift work, but take it at a time you're going to be sleeping, I should say. You're lying down, so most of it gets absorbed. Okay? The other question is, if you're taking it vaginally, what do you do about intercourse? And I'm afraid it is a bit of a killer for romance. But if you're going to have sex, then try and plan that you have a wee, your last wee of the day, at night after you've had sex, because we always encourage weeing after sex, and then place it then. I hope this video was helpful.